There's a little bit of wrinkling that we see down here, relax. And some of this is due to just elevating the cheek. But then we have a circular muscle that surrounds the eye called the orbicularis oculi, and that muscle is responsible for us being able to close our eye. But we don't have eye down here, but it's acting on the overlying soft tissue, skin, and causing wrinkling. So smile again, Sue. So what we're trying to do is soften that effect bilaterally. So when she smiles for her photos this summer, we won't see that. And so the filler of choice today is Radiesse. Radiesse will actually encourage your own tissue to grow into the scaffolding that this creates. Oh. And so as a result, we get more long-lasting action, up to 12, sometimes 18 months. So we refer to this as a semi-permanent volumizer, and with her icing, we're just about ready to go. One of Sue's biggest concerns was the appearance of her eyes. And what I'd like to do is to treat this region here. We call this a tear trough area. And we know that our infraorbital nerve is about in this location, so we want to avoid that. And what I'm going to do just beyond this is give Sue a little beauty ouch on 3. 1, 2, 3, beauty ouch. And again, there's not a lot of soft tissue here, so we don't want to be too aggressive. We just basically give Sue just a little smidgen of a treatment. And I'm going to stop, and we'll just mold that into place. Get a nice little molding effect. And that's the nice thing about Radiesse, is it allows you to mold the tissues and the product so that you can get a nice, smooth appearance. I'm going to give Sue just a little bit more. We're going to go down here in 3. 1, 2, 3. Sue, here's a beauty ouch. And again, one of the nice properties of Radiesse is that it's so malleable. So I have a lot of opportunity to mold the product and to move it to areas where I want it to be. And again, I'm almost on bone. That's my target area. Also in the malar region and the chin area too. I want to be fairly deep, and that looks very nice. She's going to have a little swelling, but I think it's a nice opportunity to demonstrate the untreated tear trough pseudo-herniation that we have on the left versus what we're beginning to treat over here, and we're beginning to see more of a blending contour here without that obvious fat pocket that we saw before we started treating. What I'd like to do is march down to the nasolabial region. 1, 2, 3. There's a beauty ouch. Beautiful. Super. And I'm in the subdermal plane, just underneath the supporting structure of the skin, and I'm using a retrograde linear threading technique. So we've just completed our treatment with Sue. We did a lot of infraorbital work here. She's going to be a little bit swollen, and that's fine. That will go down. We always treat conservatively in this region. I can bring her back in a week, which I'll do, and we just give her a little touch-ups where we need to. We've lifted the midface and softened the nasolabial region bilaterally, giving her a nice appearance. So I'm very happy with today's treatment. How do you feel, Sue? You okay? Mm-hmm. Good. Yeah. Excellent.
Looks great.
Now, one of the things you talked about as well was the lipstick peel line. You can see this is softened, but it's not completely gone. And then I would refer you to see Sherry for a little laser treatment, Liz as well for microdermabrasion, and that would help to further soften that region.